Welcome to SR PHARMA GYAN. So today we are going to discuss on the mechanism of action of local anesthetics. In our last video we have discussed on the introduction, classification and chemistry of the local anesthetics. So today we will discuss on the mechanism of action of local anesthetics in detail. So local anesthetics, whenever we are talking about the local anesthetics, these are the agents which upon topical application or local injection cause reversible loss of sensory perception, especially pain, in a restricted area of the body where they were applied. So in case of the local anesthetic, we can say that they will cause the reversible blocking of voltage gated sodium channel. So they will block the voltage gated sodium channel, but it is the reversible in nature. Therefore they will cause the blocking of nerves, cause the inhibition of transmission of impulses. So as it will block the voltage gated sodium channel, so it will block the nerve and therefore there will be the inhibition of transmission of impulses. And as there is a inhibition of transmission of impulses, then it will lead to the loss of sensation of pain. It will cause the loss of sensation of pain. We have seen that the local anesthetics can be classified based upon their application. It is the either injectable or the surface local anesthetics. In chemical wise or the chemistry wise, if you want to classify, then there may be the amide type or the ester type. So today we are mainly discuss on the mechanism of action of this sort of drug in detail. So coming to the mechanism of action, as we have told that local anesthetic, they will suppress the action potential. They are going to suppress the action potential and they will block the voltage gated sodium channel. They will block the voltage gated sodium channel. But the structure of the voltage gated sodium channel is complex. The structure is complex. And this voltage gated sodium channel is composed of alpha subunit. It is composed of the alpha subunit and beta subunit. Alpha subunit and beta subunit. So it is generally composed of one alpha subunit. One alpha subunit which forms the pore. And one or two beta subunit. Now if you see about the alpha subunit, it is composed of the four domain 1, 2, 3 and 4. So alpha subunit, it is composed of four domain, each domain containing 6 segment, which can be denoted as S1, S2, S3, S4, S5 and S6. So each domain consists of 6 segment, 1, 2, 3, 4, 5, 6 segment, which are again connected by a loops. And so total there will be the 24. There will be the 24 segments in the alpha subunit of voltage gated sodium channel. So there will be the 24 segment in the alpha subunit. The channel is formed by the channel here means the pore of the channel. The pore or the channel is formed by the S5. This is the S5 and S6 segment. S5 and S6 segment and the short loop of amino acid that links S5 and S6. That means the pore is formed by the S5, this is the S5 and S6, and the loop which is connecting the S5 and S6. So here also it is the same, S5 S6 S5 S6 S5 S6. So pore, it is formed by the loop which is composed of the amino acid, the loop, this is the loop which is composed of the amino acid which is connecting S5 and S6. So that is very, very important. Now this voltage gated sodium channel, they composed of two gate. They composed of the two gate. One is the activated gate and inactivated gate. The inactivated gate. Now activated gate means there will subunit comes together, these segments it will come together and they will forming the gate which is known as the activated gate which allows the sodium to come inside. Another thing is that inactivation gate or inactivated gate which is formed by the loop which is connecting domain 3 and domain 4. So this is the loop, clear? This is the loop which is connecting domain 3 and domain 4. So this inactivated gate is formed by the loop that connects domain 3 and domain 4. Next is this S4, clear? S4, clear? If we are talking about the S4 segment of each domain, S4 segment, clear? S4 segment of each domain has positively charged. It is positively charged. Why it is positively charged? Because they contain, clear? They contain arginine or lysine amino acid. So S4, they contains the arginine or lysine amino acid and this is the positively charged. This is the positively charged and is the voltage sensitive region, and this is the voltage sensitive region. So this S4 segment, S4 of each domain is the voltage sensitive region of sodium channel. So S4 is the voltage sensitive region of sodium channel. Now if we are talking about, because they contains the two category of subunit, alpha and beta. Now if we are talking about the alpha subunit, now alpha subunit is sufficient for ion conduction. What are the function? Ion conduction and voltage sensing. So alpha subunit is sufficient for ion conduction and voltage sensing, whereas, so this is about the alpha subunit. Now if we are talking about the beta subunit, now beta subunit, it is also play major role. It is also playing a major role. So what are the major role? This is the modification. They are responsible for the modification of channel, learn modification of channel, then expression, localization. So beta subunit is responsible for modification of the channel, expression and localization. Now if we are talking about this alpha and beta subunit, where the local anesthetic binds, clear? Where the local anesthetic bind, that is also important. Now local anesthetics, it is bind in this particular area. So binding site of the local anesthetic. binding site of the local anesthetic, it is located in the S4 domain. It is located into the S4 domain. So binding site of the local anesthetic, it is in the S4 domain, loop S6. Clear? So this is the loop. So loop S6. Clear? Loop S6. So it is present into the loop S6. And it is only accessible. That means local anesthetic can bind to this particular area when the channel is open. That means when the channel is in the activated state, when the channel is open, then only the local anesthetic it will go and it will bind to the S6 loop, clear? S6 loop of domain 4, clear? Of domain 4. So this is the complex structure of the voltage gated sodium channel where the local anesthetic binds. Now if we are talking about the sodium channel already we have told that they contains the activation gate and inactivation gate. So two gates are there, activation gate and inactivation gate. Now this sodium channel can be present into the three different conditions. They can be present into the three different condition or the state, three different state. So first one is the resting condition. Resting condition means this is the non-conducting. This is the non-conducting. That means the sodium cannot come inside. Sodium cannot come inside. Why? Because in the resting condition, activated gate is closed. Activation gate is closed, though the inactivation gate is open. Because one of the gate is closed, so sodium cannot come inside. So this is, you can say that this is, we are showing that transmembrane potential. So in that condition, this is the resting membrane potential. Now what is resting membrane potential? This is the charge difference across the membrane. That means if we are comparing the charge in the cytoplasmic site compared to the extracellular site, so in the cytoplasmic site where the charge it will be less compared to the extracellular site, or it will be more than the extracellular site, that comparison. Now in the resting membrane potential, generally resting membrane potential it is in between the -90 to -60 millivolt. Clear? In the nerve action, this resting membrane potential in between the -90 to -60 millivolt. Because in this case already we have told that resting condition sodium cannot come inside. Then in case of the activated stage, this is the conducting stage, so sodium it will come inside. Clear? Sodium it will come inside. Now why the sodium it will come inside? Because in the extracellular side sodium concentration is more. Extracellular side sodium concentration it is more, and intracellular side or cytoplasmic side sodium concentration is less. So sodium it will come inside the cell. Clear? Come inside the cell. As the sodium is coming inside, that means positively charged ion is coming inside, so that membrane potential is rising. And this is known as a depolarization. Or this is we can say that this is nothing but the action potential, depolarization. And it may goes up to +30, +40 millivolts, that rest membrane potential. Then after it will reach to the maximum till the activated stage, the sodium it is coming inside the cell, so the membrane potential going up. Now in the inactivated stage, activated or activation gate it will be open, but inactivation gate it will be closed. So again, as a result, sodium cannot come inside. And in this time, this is called as a repolarization. The potassium ion So potassium ion, which is a positively ion charged ion, they will go outside of the membrane, because inside the concentration of the potassium ion is more, so that action potential it is coming down, action potential it is coming down, and it is coming into the resting potential. So the voltage gated sodium channels, they can be present into the stage or the three condition. This is the resting, activated and inactivated. Clear? Resting, activated and inactivated. Whenever the local anesthetic it will act stage, they will responsible for the inactivated stage. That means inactivation gate it will be closed for a longer time, so action potential, so there is a no generation of action potential. So because you can say that this is the membrane potential, so there is a no generation of the action potential, no propagation of the action potential. As a result, the local anesthetic stop impulse conduction in the CNS, and thereby they will inhibit the reaching the pain sensation to the CNS. Now we'll see about that where the local anesthetic is acting. Now this lipid bilayer, this is the lipid bilayer, this is a barrier for the hydrophilic molecule, because it is a lipid bilayer, so there is a barrier for the hydrophilic molecule. Lipid solubility is the requirement of local anesthetic, so it is, we can say that lipid solubility, because lipid solubility is a requirement for the local anesthetic to enter the cell. So in the resting stage, if we are talking about the resting stage, what will happen? Activated gate it is closed, already we have told. Inactivated gate is open. So as the activated gate is closed, so sodium cannot come inside, and this site is the where the local anesthetic it will bind. That means it is located near to the inactivation. This is the inactivation gate, and this is the activation gate. But as we have told, lipid solubility is important requirement for local anesthetic to enter the cell. Now most of the local anesthetic, if we are talking about the local anesthetic, most of the local anesthetic are weak base. Most of the local anesthetic are the weak base, and they are prepared, whenever they are prepared as a hydrochloric salt. They are prepared as a hydrochloric salt, which is frequently expressed as NH4 minus hydrogen, so NH4H. Now in the activation stage or the active stage, the next is the active stage. So both the gate activation and inactivation gate is open, so sodium it will come inside. Clear? Sodium it will come inside, that is into the activation stage. Now what happens to the local anesthetics? Clear? Local anesthetics. These local anesthetics are cationic form. They are into the cationic form. They will convert into the unionized. Lipophilic form. This unionized lipophilic form, they will cross the lipid bilayer, and they will reach to the axon. So this is the, they will reach to the axon, that means exoplasm of neuron, because we are talking about the neurons only, so they will reach inside the cell of neurons. Then after reaching inside the cell, this local anesthetic, clear, local anesthetic, they will gain a hydrogen ion, and it will be again ionized, that will convert into the ionized form, and this form actually is responsible for the local anesthetic action. That means they will block the sodium channel, Now equilibrium, if we are talking about this equilibrium between the unionized and the ionized form, this equilibrium in between the unionized and the ionized form, it is determined by the pH of the tissue. This is determined by the, so pH is important, pH of the tissue, and pKa value of anesthetics. pKa value anesthetic. So these two are the important, factor, clear, these two are the important factor. Now this is the activated stage, clear, this is the activated stage. Now what will happen, this ionized form of the local anesthetic, they will go and they will bind to the local anesthetic, they will bind to a particular site. Already we have seen the site where they are going to bind. So it is bind in the domain where it will bind, it is nothing but the, if we are talking about the this site, it is nothing but the domain 4 loop S6 of alpha subunit. Already we have discussed subunit, which is near to the inactivation gate, So local anesthetic, they will go and they will bind to this particular site. This is also known as a local anesthetic receptor. Now after binding, when the local anesthetic bind here, this inactivated gate, it will be closed, so now the channel in the inactivated stage, it will be in the inactivated stage. So if this gate is closed, what will happen, sodium cannot come inside, so there is a inhibition of the action potential, and this binding is the, if we are talking about the this binding, reversible binding, this is the reversible binding, clear. So it will bind, so sodium cannot come inside. So what will happening, after binding of local anesthetic, to its receptor, it stabilizes the channel in the inactivated stage. It will stabilize the channel into the inactivated stage, thus reduce the you can say that probability of the channel opening and the impulse generation. So it will inhibit the probability of the channel opening and the impulse generation. So this is about the mechanism of action of local anesthetics. So if we are discussing the local anesthetics, clear, if we are discussing the local anesthetic mechanism in brief, what we can see that local anesthetics, it will bind to voltage gated sodium channel, of course when it will be into the activated form, and thereby block the sodium channel, voltage gated sodium channel, it will block. Therefore no entry of sodium, clear, no entry of sodium inside cell. If it is no entry, no depolarization, so we can say that no depolarization, that means no generation of action potential and conduction of impulse. Clear? Conduction of impulse to CNS. So if there is no conduction of impulse to the CNS, it will cause the local anesthesia. So this is the mechanism of action of local anesthetics. So hope this you have understood the mechanism of local anesthetic. We have discussed in very details. If you have any doubt, any confusion or any question, please write us in our comment box. These are the some of the reference. Hope this video will useful for you. Thank you for your support. If you feel that the video is informative and useful, please share the video and join us. Subscribe the SR Pharma Gyan for more update. Thank you once again.